for some people to join us. Hello. Nice to see you. Thanks for joining us, or joining me today. You can just start at about, say, like 6:04. Hi, Tammy. Hi, Alec. Thanks for tuning in today. Hello. Let me wave at everyone. Thank you guys for joining today. I'm really excited. Is there still one more week in September? Yes, there is. But I think we're going to be talking about some really interesting stuff today, so I'm glad that I have some viewers. Aw, thanks Tammy and Alec. Love y'all. All right, we can get started in, say, like 30 seconds. Has everyone's day been good? What did everyone do today? Just was excited it was a Friday. That's how I feel. All right, so we're going to go get started. Hi guys for coming in today. My name is Ibukun. I use she, her pronouns. And today we are going to talk about another sexual health topic. And, oh, that's fun. Yes, that's fun. And work. Yeah, I feel that. Aw, Tammy, tennis is going to be fun, I'm sure. And just for today, if you have any questions, I really want this to be interactive. So if you have any questions or any feedback to what I'm saying, please leave it in the chat and I will definitely acknowledge it. So let's just make this as interactive as possible. So during the last year, Whitman-Walker Health's Community Health Department has expanded its outreach efforts to the social media platform. So we've covered various topics about STI and HIV, sexual health practices. We've talked about access to care. We've talked about the social determinants of health and general public health interventions. The next series of outreach sessions will focus on the current pandemic, COVID-19, and ways to manage your sexual, personal, and mental health. And the community health team is here to educate you and support you. I literally just ran into a video. Would love to collaborate with you all. I'm the first ever openly HIV positive born stand-up. Wow, that's really awesome. Thank you so much for joining us today, Andy. And yes, I would love to connect with you. So if you could send us a message, and we could just like connect to see if we can bring you onto this platform. We would love to share your story. So thank you so much for joining us today, Andy. And the month of September, we have dedicated it to raising awareness about sexual health. And we all know sex is a normal aspect of human life, and it is really important that we're all well informed about our sexual health. So according to the WHO, the World Health Organization, sexual health is defined as a state of physical, emotional, mental, and social well-being in relation to one's sexuality. So it's not merely the absence of disease, dysfunction, or infirmity, but sexual health requires you to be in a positive, respectful, and requires a respectful approach to sexuality and sexual relationships, as well as also having the possibility of having pleasurable and safe sexual experiences that are free of coercion, discrimination, and violence. So I just really want us to take note of what sexual health means and what it does not mean. So, like, I've been coming on the platform throughout the entire month of September, and I've discussed a different topic in relation to sexual health. And today I want to talk about sex and how can we have sex during the pandemic and just the relation between sex and COVID-19. So, despite encouraging everyone to physically, socially distance themselves from others and minimize contact with other people outside of your home to slow the spread of COVID-19, we also understand and recognize the importance of sex for many people, and that some may continue to have sex with others outside of their household. So today we're going to discuss the ways to stay safer and also reduce your risk of contracting and spreading illness during sex, during this pandemic. So first, let's just talk about COVID-19 and how it's spread and how it's not spread. COVID-19 is spread when you are within 6 feet of an infected person who coughs, sneezes, and releases respiratory droplets. So you can get COVID-19 by being in direct contact with infected saliva and mucus. Researchers also found that the virus can live on surfaces and may be spread when a person touches those same infected surfaces and then they go on to touch their face or any other body part that kind of has like an entrance into the body. So this is important to note that you may also contract COVID-19 while kissing an infected individual, whether they're asymptomatic or symptomatic. There's still a lot to be learned about COVID-19 and sexual activities. However, there's currently no evidence that the COVID-19 virus is transmitted through semen or vaginal fluids. But I just want us to note that they have detected COVID-19 in the semen of people who are recovering from the virus. So now, I guess we could talk about what kinds of sex are the safest during a pandemic. So ultimately, your safest sex partner is yourself. So masturbation will not spread COVID-19, especially if you practice safety habits like washing your hands before and after sex, and also washing and cleaning your toys with soap and water for at least 20 seconds before and after sex. Your next safest safety partner is someone whom you're currently living with and sharing a space with. So having sex with someone who is in your living environment really would reduce the risk of the spread of the virus. So we also recognize that this is not feasible for everyone's lifestyle and that some people make a living by having sex. So in cases where you cannot have sex with someone in your direct living environment, we are encouraging people to minimize the amount of sexual partners they're having. And also don't forget that you have PEP and PrEP that is available to you, and you can use them when you know that you may have a known exposure to HIV. And also don't forget to continue prioritizing using condoms. And also, if you meet your sex partners on the internet, you might want to consider having virtual dates versus in-person dates. There are options such as like video chatting your partners or sexting or even chat rooms are available. And these are much safer options for you and your living environment and will help minimize the spread of the virus. So as I mentioned earlier, COVID-19 can easily be spread through kissing, especially when kissing someone who might be asymptomatic. There's also some evidence that the virus can be spread through contact with feces. So to prevent the spread, we encourage people to avoid rimming, which is having a mouth on an anus. This will help prevent feces entering your mouth and prevents the spread of the virus. And also, you want to maintain clean hygiene, and it's even more important than ever to maintain clean hygiene. So washing your body with soap and water before and after sex will help prevent the spread of the virus, in the case you and your partner had come in contact with the virus prior to having sex. Also, remember to disinfect keyboards or phone screens or your iPads, any touch screens that you may be using or you might be sharing with others for video chatting, watching pornography, or anything else. And in the case that you or your partners end up feeling unwell, we urge you to please skip sex. If you experience any of the COVID-19 symptoms, refrain from any sexual activity with others, including kissing. And don't forget to take the usual steps to prevent HIV, STIs, and unplanned pregnancies if you have the ability to get pregnant. So make sure to use the condoms, PrEP, PEP to prevent HIV. And also, don't forget that condom usage will prevent the transmission of STIs. And the use of birth control is also an effective form of contraception to prevent unplanned pregnancies. So in conclusion, do your best to not have sex with anyone outside of your household to really reduce the transmission of COVID-19. But if you do remember, please practice safe sex. So masturbation does not spread COVID-19, and it is your safest form of sex. You want to make sure to wash up before and after sex. And remember that kissing is an easy way to pass COVID-19. It might be a good idea to consider phone or video dates, and sex you might want to consider phone or video dates as an acceptable alternative to in-person hookups. So if you are close enough to having sex, you are close enough to spread and be exposed to COVID-19. And don't forget, Whitman-Walker is still here for you. So we offer free confidential HIV STI testing at our 1525 14th Street Northwest, or we also offer it for free at our Max Robinson Center in Southeast DC in Anacostia at the corner of Martin Luther King Jr. Drive. And don't forget that these appointments are by appointment. These STI tests are by appointment only, and you can call us at 202-797-4439 to make an appointment. We're currently not taking any walking appointments at this moment due to COVID-19 restrictions. And along with receiving a test of Whitman-Walker or other health clinics in the DMV, there's also an alternative known as in-person testing or in-home testing. And these tests provide you with the privacy of your home and the flexibility to choose what you want to test for. So these tests can be purchased at CVS, either online or in person, or you can also get them at everlywell.com. And they range from $80 to $200 for the testing kits, as well as at-home STI kits. Please note that there may be user error due to doing the test yourself, so please make sure to call our resource line if you ever need help. We are always here to help you. And a disclaimer, if you, someone you live with, or someone you are involved with has symptoms suggestive of COVID-19, including coughing, fever, shortness of breath, you should take a timeout. So no dating, no sex. Instead, you should call your doctor or medical provider and ask if testing is appropriate and figure out whether and how you should be seen. So before I end off, I just want to know, does anyone have any questions for me today? All right, well, before we go, I just want to give you a few reminders about the COVID-19 and vaccines. So if you've already been vaccinated, congrats. You've taken a really important step to preventing yourself, your loved ones, and your communities from illness. There's a lot of different variants, such as the Delta variant, soaring across the U.S. at this moment, and it's totally understandable why you might want to keep wearing your mask for the safety of others around you. And if you haven't been vaccinated and you are looking for an appointment, Whitman-Walker Health does have the COVID-19 vaccine available. So everyone ages 12 and up are eligible to receive the Pfizer COVID-19 vaccine, and everyone ages 16 and up are eligible to receive a COVID-19 vaccine. So please reach out to us at 202-207-2480 to make an appointment. And if you're having any trouble making an appointment with us and you live in DC, you can call 1-855-363-0333, or you can also go to vaccinate.dc.gov to get more information about COVID-19 vaccines around you. If you're in Maryland, you can call 855-634-6829, or go to covidlink.maryland.gov to find out more information about vaccinations in Maryland. And if you're in Virginia, you can call 877-829-4682, or you could go to vaccinate.virginia.gov to find out more information about Virginia COVID-19 vaccination efforts. And if you haven't been vaccinated and you're not looking for an appointment, please continue to follow the CDC guidelines for mask wearing, quarantining, social distancing, and everything else. It is very important that you consider getting the vaccine. Discuss COVID precautionary measures with those around you. Be mindful of masks and keeping your distance, especially when you do not know whether the people around you have been vaccinated or not. And finally, we just want to remind you guys about ways to support Whitman-Walker Health. We are having our annual Walk to End HIV virtually this year on October 23rd on Saturday. And please, this is a really special year for us because it's our 35th anniversary of the walk. So if you would like to support us, please sign up for that with you, yourself, your friends. And remember to follow us on Instagram, Facebook, Twitter, and TikTok at Whitman-Walker, and checking out our website, www.whitman-walker.org, for the most up-to-date information on our services, as well as our COVID-19 resources. And the number you can use to call us if you have any questions is 202-797-4439. And you can also follow some of our other programs and Whitman-Walker Health Family at Real Talk DC _, at No Filter DC, and at The Corner DC. Thank you again for coming today and for joining me and spending this time with me. And I hope you all have a beautiful Friday. Bye.